Whip spring is used for correction of. I don't think you people must have heard of this terminology. Like a whip spring, it is a wire component of a removable appliance. Okay, and it is used in the correction of rotation. So yes, this is how my whip spring use is looks as seen in the figure. This is a whip spring. Students, please note that I am putting in a lot of efforts to make sure you people are understanding. Along with each MCQ, there is a photograph, there is a diagram, and I'm explaining you everything. Okay, so please, don't be hassled if you don't know anything. Next, I am here to guide you people. You don't have to go back to your textbooks and open up things. Okay, I'll be telling you each and everything. This is not taken from one particular textbook. It has been compiled after going through multiple textbooks in orthodontics, and the best of questions have been brought forward for you guys. Okay, so do not get hassled. Don't worry if you don't know anything. Okay, or you don't need to go in depth of each and everything. Whatever is required, I'll be telling you people. Okay, so if you have not seen whip spring earlier, you have not heard about it, it's okay. I'm telling you people, okay? So just listen to the video again and again. That is what I can request you people. Open my YouTube channel and keep seeing the videos again and again. That will be a very good revision for you people. And it will be more than enough also. Okay. So yes, whip spring is used for the correction of rotation. Okay. In case we want to correct proclination, what do we use? We use a labial bow. If we want to correct a cross bite, what do? We relieve the occlusion so that the cross bite can be corrected. Or we can even use Z springs if there is an anterior cross bite. What do we do if we want to correct an open bite? For correction of open bite, if we have fixed orthodontic treatment going on, then elastics can be given. Posterior bite plates can be given, okay, to intrude the posterior teeth. So this is all something which you should know. So to correct rotation, whip springs are used. Okay, so the correct answer is option A. If you have got this answer wrong, it's okay. This was a tough question. Okay, moving on to the next one. Very important, very important. This is very important even if you are an ortho resident or a BDS student. Okay, this is like important throughout your orthodontics. The normal facial index is, what is facial index? First thing. Okay, facial index is calculated by, can you see here? Yeah. Distance between nasion and nathion divided by the bizygomatic width. Okay, so we take the patient, what do? We take measurements directly on patient from nasion to nathion. Okay, and the distance between the bizygomatic width. So this is the distance from nasion to nathion, and this is the bizygomatic width. Okay, so distance between nasion and nathion is suppose 10 millimeters, and the distance between the bizygomatic width is 8 millimeters. So we divide 10 by 8. So whatever we get, we calculate the facial index. Okay, and the normal facial index ranges from 80 to 90%. Now, if it is below 80%, what does it signify? If it is beyond 90%, what does it signify? So there are terminologies for it. Okay, most important terminologies to be remembered over here, students, is uriprosopic, mesoprosopic, and leptoprosopic. Mesoprosopic is normal, that is, it is in the range of 80 to 90, that is 85 to 89.9. Okay, if it is below 80, it doesn't mean that the patient is abnormal or there is anything wrong. No, the patient has a different facial index and a different, cephalic index is different. Facial and cephalic index. It is just that the patient profile would be different. He might be uniprosopic. Okay, and if it is beyond 90%, the patient is leptoprosopic. Leptoprosopic people generally have, a long face. Mesoprosopic has a normal face. Uriprosopic has a short, round face. That kind of a thing. So knowing the facial index is very important. You should know how to calculate the facial index. Facial index is equal to distance between nasion to nathion divided by the bizygomatic width. The normal value is 80 to 90%. Okay, and the terminologies for facial index is uriprosopic, mesoprosopic, and leptoprosopic. So this is very important. Highlight it and make a note of this thing. Okay.